Have Asher here, and he's very kindly agreed to do a testimonial after I gave him two brand new shiny hips. His left side I undertook, he undertook 4 months ago, and his right side 2 months ago. And over to you, Asher. How are you doing?
I'm doing good, Paul. Thank you so much.
Great. And you're able to kind of walk around freely and do stuff?
Yes, I'm able to walk around. I have resumed my normal activities. I'm yet to resume work. I'm a pilot by profession, and it suddenly struck me by surprise, this diagnosis of avascular necrosis. And I was lucky to come across you, and you pretty much diagnosed it absolutely correct. And the solution you gave was pretty much what I also discovered from other doctors, that is the right thing to do.
Mm.
And it was very painful, and it was
Before the operation.
before the operation, I was very disheartened. That how did this happen to me and stuff, because I had a pretty much very active life before this happened, and suddenly I was gaining weight, not moving much because of the pain. And I'm really glad that I met you, and you did a fantastic job on it, and I'm able to walk.
A good landing, eh?
Yeah, a good landing.
Yeah,
Yeah, that's what we say. Yeah, and
yeah, it's very nice. I mean, it was a pleasure to treat you, and obviously, when you are younger, I mean, you recover so much quicker and faster as well. And people are quite surprised because obviously you're only 30. Well, you're 35 when you're diagnosed, 36 now, and it's a joy to do patients at that age because they heal so much faster and they go back to full recovery and back to gym and running and doing all their stuff, and then they report back to us, and they virtually don't need to see us. It's usually a hello in the clinic. Everything is good. We may take an X-ray in a year. We then may take an X-ray in 5 years. As simple as that. You know, you've almost finished with me in that respect, which is really nice as a doctor to be able to solve someone's problem. And I think you touched on a very important point, which was the psychological impact this has, particularly when you wait a significant amount of time. And obviously the worry that you might have about your job, because obviously you cannot function in most professions without being able to be mobile, particularly as a pilot. So this kind of mental stress of not knowing when things are going to get done, and then almost overnight things get solved for you. And that's the beauty of a hip replacement. It really is that good.
Yes, absolutely agree with that.